Project 2025 is a plan designed to fundamentally change the way America is governed. Its goal is to concentrate power in the hands of politicians, judges, and corporations while reducing the influence of everyday citizens. Experts warn this plan would dismantle essential checks and balances, threatening the democratic protections that ensure fairness in government. In this video, we'll take a close look at how Project 2025 would specifically impact New Hampshire, affecting taxes, Social Security, healthcare, reproductive rights, childcare, student loans, and public education. Under Project 2025, taxes for working families would rise sharply, while the ultra-wealthy would receive massive cuts. In New Hampshire, the typical family of four would pay an additional $1,741 per year. Meanwhile, 45,000 households nationwide reporting over $10 million in income would each receive an average tax cut of $1.5 million annually. This shift would place a disproportionate burden on the middle class, effectively transferring wealth from ordinary families to the richest Americans. The plan also threatens to reduce federal funding for programs that rely on tax revenue, further straining local communities in New Hampshire. Project 2025 supports proposals to raise the Social Security retirement age from 67 to 69. In New Hampshire, this would affect roughly 956,976 residents, about 69% of the population eligible for Social Security. Raising the retirement age would reduce benefits by $4,100 to $8,900 after just 1 year, depending on when recipients claim benefits. Healthcare protections would also be weakened. Project 2025 proposes imposing limits or lifetime caps on Medicaid benefits. In New Hampshire, 30,600 Medicaid and release primarily low-income individuals without access to alternative affordable coverage would be at risk of losing their health insurance. Additionally, the plan would eliminate out-of-pocket limits for Medicare prescription drugs, affecting 72,960 residents who rely on regular medications. By blocking the government from negotiating lower drug prices, Project 2025 would make essential medications significantly more expensive, creating serious financial and health consequences for seniors and vulnerable populations. Project 2025 would also dramatically restrict reproductive freedoms. It eliminates certain emergency contraception medications from free preventive care requirements, meaning 211,000 women in New Hampshire could lose guaranteed access. The plan directs the U.S. Department of Justice to misapply the Comstock Act laws from 1873 and 1909 to criminalize mailing medication abortion, effectively imposing a nationwide abortion ban, even in states where abortion is currently legal. Local officials who refuse to prosecute women and doctors under strict state abortion laws could face federal legal action, increasing legal risk and uncertainty across the state. Childcare programs would be cut as well. Project 2025 eliminates Head Start, a program that provides no-cost childcare and early education services for low-income children. In New Hampshire, 1,234 children would lose access to these essential services. Rural and underserved communities, which already face shortages of childcare providers, would be hit hardest, forcing families to either reduce work hours or leave the workforce entirely, impacting household incomes and local economies. Project 2025 would replace income-driven repayment plans with a one-size-fits-all system. For 27,600 borrowers in New Hampshire enrolled in the Biden-Harris administration's SAVE plan, this would mean paying $2,700 to $4,100 more per year. For young adults and families trying to get a start, these higher payments could delay home ownership, increase financial stress, and make pursuing higher education far less accessible. Public education funding would also be slashed. Project 2025 proposes eliminating the U.S. Department of Education, including Title I funding, which provides additional resources for schools serving low-income students. In New Hampshire, 554 teaching positions would be cut, affecting 6,372 students. Schools would lose access to essential programs and support services. widening the gap between well-funded districts and those in low-income communities, and reducing educational opportunities for the next generation. In summary, Project 2025 would raise taxes on working families, cut Social Security, reduce access to health care, restrict reproductive rights, eliminate child care programs, increase student debt, and weaken public education. These policies would place significant burdens on New Hampshire families and communities, creating long-term economic, social, and health consequences. It is essential to understand the real impact of Project 2025. Stay informed, share this information, and speak up to protect your rights and the well-being of your community. Decisions like these affect every resident of New Hampshire, and your voice matters.